The target audience of patients that I chose was diabetes mellitus. This includes type 1, type 2, and gestational diabetes. It affects all ages, genders, and races. Medication that I chose was insulin, which include short, rapid, long, and intermediate acting. I chose diabetes mellitus because it makes up the majority of people that I work with every day. Insulin was a drug of choice that I chose because it's very hard to understand, especially for newly diagnosed patients. I would first sit down with the patient and assess what they may already know about their disease. Second, I would assess for any learning barriers that the patient may have and their best way for learning. From experience with diabetes patients, the best way for learning how to administer insulin would be one-on-one return demonstration. I chose this method for learning for this population of patients because I think it has the best outcome for learning and seeing how much the patient has learned. By having a patient one-on-one, you have their undivided attention. Return demonstration works the best because it shows visual, auditory, and physical. These three actions are needed, especially when teaching a diabetes patient how to check their blood sugar, drop the correct amount of insulin, and how to carefully self-inject it. Materials that I used for teaching was a brochure that I made, and then also the insulin skin rotation man. This is the brochure that I made for patients with diabetes. On the left, I show the targeted population, which is type 1, type 2, and gestational. For type 2 diabetes, I, over here, showed that it could be people that are obese or overweight. It could be their ethnic background, Hispanic, Latino, African American. You can get diabetes from uncontrolled high blood pressure. You can also get type 2 diabetes from gestational diabetes. It can be in the family history and also just the age. Type 1 usually starts in childhood. The main things that lead to it would be family history, infection, or illness. Insulin is a very high alert medication, so it can cause significant patient harm when it's used in error. That's why it's important to teach your patient about insulin when sending them home. The mechanism action for insulin is regulation of glucose metabolism. Insulin promotes glucose and amino acid uptake into the muscle and adipose tissues and other tissues except for brain and liver. It also has an anabolic role in stimulating glycogen, fatty acid, and protein synthesis. Insulin inhibits glucogenesis in the liver. Insulin is generally well and rapidly absorbed from the site of injection. Absorption does not differ if it's subcutaneously administered into the arm or abdomen. So the different types of insulin that I would teach my patient would be the rapid acting, which is Lispro. The onset of it is 15 minutes. The peak is 60 to 90 minutes, and it lasts for 3 to 4 hours in their system. Short-acting insulin, such as regular Humulin Novolin, which is the most popular insulin used, is 30 minutes to an hour. It's usually taken before meals. The peak is 2 to 3 hours, and the duration is 3 to 6 hours. Intermediate, which is NPH, which is usually given every 12 hours. The onset is 2 to 4 hours. The peak is 4 to 10 hours, and the duration is 10 to 16 hours. Long-acting insulins, such as Lantus, the onset's 1 to 2. There's no peak, and it can last for 24 plus hours. So the therapeutic use of insulin is with a proper diet and exercise program. It's used to control high blood sugar in people with diabetes. Controlling high blood sugar helps prevent kidney damage, blindness, nerve damage problems, loss of limbs, and sexual function problems. Proper control of diabetes may also lessen your risk of heart attack or stroke. So with this medication, there's a lot of side effects. Number one being hypoglycemia. I would tell my patient the symptoms of low blood sugar, which may include headache, nausea, hunger, confusion, drowsiness, weakness, dizziness, blurred vision, fast heartbeat, sweating, tremors, trouble concentrating, confusion, or seizures. People can also have allergic reactions such as anaphylaxis, itching skin, rash all over the entire body, wheezing, trouble breathing, and fast heart rate. The desired outcomes of insulin would be to control the blood sugar levels in the diabetic patients without the appearance of hypoglycemic or hyperglycemic episodes. So for patient teaching, I would teach my patient the proper techniques for administration, which include the type of insulin, equipment such as syringe, cartridge pens, alcohol swabs, where to store it, and the best place for discard for syringes. I would show the rotation injection sites, which I'll show you on the Skin Man after. And compliance with the therapeutic regimen is important. Insulin pens should not be shared with others, even if the needles are clean. The technique for mixing insulins by drawing up regular insulin or insulin lispro first and rolling the intermediate acting insulin vial between palms to mix rather than shaking. This medication controls hyperglycemia but does not cure diabetes. The routine testing for serum glucose and ketones are important. Compliance with nutritional guidelines and regular exercise is also important. You would want to notify your healthcare professional of medication regimen prior to treatment or surgery. Notify healthcare professionals if nausea, vomiting, or fever develops if unable to eat regular diet or blood glucose levels are not controlled. You want to be aware of the signs and symptoms of hypo and hyperglycemic crises and what to do if they occur. You want to notify your healthcare professional if pregnancy is planned or suspected or breastfeeding are planned. Patients with diabetes mellitus should carry a source of sugar such as candy. And you want to identify describing their disease and treatment regimens at all times. It's important for the regular follow-ups, especially during the first few weeks of therapy. So that's the brochure I made that I would send home to my patient with discharge. This is the insulin Skin Man that I chose for insulin injection rotation sites. So the main places that you would want to show your patient would be any fatty prominences such as the abdomen, bilateral legs, the backs of the arms, the posterior of the back, the sides of the legs, and also the bilateral buttocks. The way I would evaluate how the return demonstration would work is I would want him or her to check his blood sugar. I would want to see them drawing up the insulin with the correct needle and have them self-inject the insulin. I would have them point out the different places to inject the insulin on their body. I would send both the brochure and the rotation man home with them at discharge. And other resources that I would provide them with would be online support groups for patients with diabetes mellitus. I think this is extremely important because people write in blogs all the time, newly diagnosed patients or even patients that have been diagnosed for plenty of years, and I think it's very helpful to see what other people have to say. For continuity of care, I think it's important for healthcare professionals to realize how much teaching this population of patients need. After teaching my patient, I would write a note for other members of my team. I would include everything that I taught the patient and the outcomes of learning for that session. This is important so other members of the team can continue with the teaching where I left off. And that is my PowerPoint.